And she's also a medical reporter and host and blogger for FoxNewsHealth.com. For those of you one-third the age I am, you know what that means, but I'm not quite sure. She is a very accomplished surgeon, a great physician. She's chief of breast surgery at Staten University Hospital, director of Comprehensive Breast Center, board certified in general surgery. She specializes in breast reconstruction. She's received several awards, Patient Choice Award and America's Top Surgeons Award. Dr. Coomer established practices to treat breast disease of all kinds. And as I indicated, she is a medical contributor to Fox News. I'm very pleased that she is with us here today, and without further ado, Dr. Cynara Coomer.
Thank you, Tony, for that very nice introduction. I'm not sure I'm worthy of it. So I wanted to tell you a little bit of my story before we go on and talk about how our lifestyles and diet of Staten Island are putting us at risk, as Councilman Oda pointed out. I was always blessed with very, very good health, and being a physician, of course that meant I didn't need a physician in my life and didn't need to go until the end of last year. And up until then, everything in my life seemed to be going just my way, especially in 2010. In that year, I was offered a great opportunity to come out to Staten Island and be the director of the Comprehensive Breast Center and lead its development of the center. I was making frequent TV appearances at Fox News. I signed up with a TV agent, signed up with a book agent, started to write on my book, and after 2 miscarriages the year before, my pregnancy this year was going perfectly well. I was even working 12 hours, 14-hour days, sometimes even 16-hour days, and still my pregnancy was going without a glitch and without complication, and all went well. On November 19th, little Olivia Rose was born at 3 o'clock in the afternoon. She weighed 7 pounds, and I was very much relieved as a 40-year-old mother to hear that my baby was perfectly healthy, had 10 fingers, 10 toes, and all looked good. So life went on with our new addition. I started back at the hospital after 3 weeks. Patients had been waiting for surgery. And I finally also got out to see my hairstylist, which for any of the moms out there, you know that that's very difficult to do. So I went and I was sitting in my chair with my hairstylist, chatting away as he was dyeing my roots back to their natural color, which is blonde. And I noticed as I swallowed that my neck looked a little distorted on one side. And I said to him, does my neck look swollen to you on one side? And he looked and he said yes, but not really understanding what I was thinking, which at this point I kind of stared at my neck in disbelief, kept swallowing up and down, and I knew at this point there was a problem with my thyroid. So I thought to myself, it's got to be pregnancy related because pregnancies wreak havoc on the rest of my body, so it might as well be my thyroid too. And I called a friend of mine as I drove home that day, Dr. Kravitz, who's a thyroid surgeon. And I said to him, do you think this could be part of my pregnancy? And he said, well, it's possible. You can get nodules in your thyroid from pregnancy. You could get a thyroiditis. So it is possible, but go and have an ultrasound. So, of course, the next day I went to my office, but my husband is a vascular surgeon, who I'm very blessed to be working with at the hospital. I went next door to his office and he got his vascular technician to, of course, put an ultrasound because after all, why would I do like every other patient, they'll get a real ultrasound. And the vascular technician who knows me started to kind of dance around the issue and said that she didn't really know what she was looking at. So I said, well, why don't you just turn the screen my way? And so she did, and I looked and saw the mass in my thyroid, and I said to her, why don't you measure that and then tell me if there's a lot of blood flow going to it, and of course there was. And so at that point I started to really suspect that what the diagnosis was going to end up being. But of course everybody reassured me. I went and did have an official ultrasound, and my friend Dr. Kravitz arranged for me to have a biopsy done the next day. So I went in for my biopsy, and of course the cytopathologist walked in, and once again, like everybody else, reassured me that this was definitely going to be benign, that I had nothing to worry about, because after all, it just didn't fit. I'm at the right age group, and everything would be fine, and odds were in my favor. I signed my consent form, and he put the needle in to do the biopsy. And for those of you who are wondering, it is not a pinch, it is not a mosquito bite, it feels like a needle in your neck. But we got through it, and everything seemed fine, and he walked out, and of course my husband and I sat there joking. with our morbid sense of humor about who was going to die first, and who was going to have surgery, who wasn't going to have surgery, and who was allowed to do what when the other wasn't around. And as we sat there joking around, the psychopathologist finally walked back in. And this time he was very straight-faced. But I held my breath and thought, you know what, maybe it is going to be okay. I'm sure this is going to be benign. And of course he said, you have papillary carcinoma. And the words hit me like a ton of bricks because I realized, wow, I have cancer. And I smiled at him and I said, fine, thank you, I understood. And he continued to speak, and I think it resembled something like blah, 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 because I didn't hear anything else he said. And he walked out, and my husband and I held each other. I immediately thought of my daughter, Olivia, and I cried and I apologized to him for letting him down. I remember saying to him, I'm really sorry, I feel like I'm damaged goods. And he thought, of course, that I was nuts. But at that moment, I knew I wasn't going to die from thyroid cancer, because I know people generally don't die from thyroid cancer. But now I knew I had to go through surgeries and I had to go through treatments, and all of a sudden I became a burden, or at least in my mind became a burden to my family. And I also knew at that moment that it was going to be time away from my daughter. And of course the thoughts raced through my head of would she think I'm abandoning her? Would she remember I'm her mommy? Would she know that I still love her? Crazy thoughts, but things that you think about at that moment. Needless to say, I did undergo surgery. Dr. Mark Erkin operated on me, did a great job, and he removed my thyroid. My tumor was 4 centimeters. It had started to erode beyond the thyroid. And so that put me in stage 2. I underwent radioactive iodine treatment, which was meant a week away from the baby. So I watched her through a video camera from the basement. Thankfully, it was a finished basement. And then I went for my follow-up scan after my treatment, and of course they then said to me, well, they found another area where maybe a tumor, and that was on my chest wall. But they were hoping that the radioactive iodine treated it, and of course 6 months later I recently went for a follow-up study and everything was fine. So I am now cancer-free. And although I have to... And like all cancer patients, I do have to worry about recurrences, but like all cancer patients, when you're told you're cancer-free, you enjoy that moment. So during this process though, and as I mentioned, although I never thought I was going to die from this disease, because I understood that it was cancer that has a very good prognosis, I never actually still thought during that time period, well, why me? In fact, I thought, well, why not me? Cancer has become so rampant, and plus I live in a community where we have the highest incidence of some cancers and the highest incidence of cardiovascular disease than any of the other boroughs, and on top of it, our mortality rate is higher. So why not me? Like many Staten Islanders, I didn't really practice preventative medicine. I didn't see a physician on a yearly basis like I should have, for checkups. I mean, after all, I thought I was too healthy. I used to tease my obstetrician and say, enjoy my pregnancy because I'm not going to be back here for a while. But as the Staten Island Advance reported this weekend, Staten Islanders don't go for yearly checkups like we should, which may be part of the reason why we have the highest incidence of heart disease in the boroughs, among other diseases. If people aren't having their high cholesterol levels and hypertension treated early, then it is going to lead, or can certainly lead to strokes and heart attacks. Heart disease and stroke are the first and third leading cause of death for men and women in the country. They are also the most preventable. In 2010, over 1.2 million Americans had a heart attack for the first time or a recurrent heart attack, which means every 25 seconds an American has a heart attack, and every minute an American dies from having a heart attack. When looking at New York, Staten Islanders have the worst death rate in the city, with 306 heart-related deaths per 100,000 people, compared to 235 per 100,000 in the city, and compared to 253 per 100,000 in the nation. As a nation, we spend $44 billion annually on cardiovascular diseases, and with that, only half of the 68 million adults with high blood pressure have it under control. With 71 million adults with high cholesterol, only 1 out of 3 has it under control. And what about cancer and deaths related to cancer? According to the New York State Cancer Registry, which is compiled by the State Health Department, Staten Island has the highest rates of breast, lung, and thyroid cancers, as well as melanoma. Breast cancer, of course, is the most common by far. And even more startling than that, is that the incidence of death related to cancers is higher than the other boroughs in the city. In fact, the rate of cancer deaths is 163 per 100,000 people compared to 142 per 100,000 people citywide. So why is that? Well, I think part of it is answered by the fact that Staten Islanders don't seem to like doctors. I don't like them either. But perhaps we do seek medical attention later than other people in the city. And that means cancers are being diagnosed at later stages, which has a huge impact on prognosis or survival. And I see this every day in my practice at Staten Island. Studies have shown that the Staten Island socioeconomic status is generally middle to high-level incomes. And in addition, we have the least number of uninsured patients compared to the other boroughs. So in other words, it's not much excuse. There are exceptions though. People in Port Richmond, Stapleton, or St. George appear to have the least insured, the least amount of access to medical care. An issue that clearly needs to be addressed on a medical and a political level. But apart from that, we do need to start taking responsibility of our own health and seek medical care as a preventative measure and not wait until we need treatment for a disease that has already spiraled out of control. While not seeking medical care is only part of the explanation for the increased morbidity and mortality rates on Staten Island, our diet and lifestyles are also implicated in these rates.